Good morning, everyone. Thanks for joining us for this morning's meeting on Alliance and ICP Restart. We'll hold off until we have a few more folks who are able to join. And while you're here, if you could type your name and organization in the chat so that those of us at DATF have an idea of attendance, that would be great. Thank you. Thanks again. As folks join, if you could just put your name and organization in the chat, that would be very useful for DATF. Thank you. We'll get started in a few minutes. Good morning, everyone. If you could mute yourselves while you're not speaking. And also for those who just joined, if you could put your name and organization in the chat. We'll begin in a few moments. Again, for those just joining, if you could put your name and the organization that you represent in the chat, that would be great. And also, when you're not speaking, just as a reminder to keep yourself muted. We'll get started in just 2 more minutes. Hello, everyone. As you join, if you could just put your name and organization that you represent in the chat, that would be great. We'll get started in 1 more minute. Good morning, everyone. Thanks for your attendance this morning. Those of us who are on the call, you've answered DATF's request answered the call to assist us with outreach as communicated by the title of this meeting and also in the communication that went out ahead of this meeting. Alliance and ICP restarts have began. It's been a while since we've done Alliance and ICP renewals. So we wanted to take this time to get communication out and a refresher about process and what individuals should expect as this process begins again. We're going to go over an overview of the changes that have happened to Alliance in the past few years, the changes that will be happening to Alliance as we approach October 1, 2022. And you'll be getting also an overview of how to create, log in to District Direct, and complete your Alliance and ICP recertification renewal. You'll be getting a lot of information today. A pen and paper may be helpful. As you can see by the agenda on your screen, we intend to get through one whole presentation. And as questions arise, you can put them in the chat, and we'll answer them at the end. But we do want to get through one whole presentation, and we'll be doing a Q&A toward after the DHCF staff that joined me today present. So just in terms of who I am, my name is Eugene Sims. I am Acting Director of the Healthcare Policy and Research Administration at DHCF. I'm also Special Assistant to the Director of DHCF. I'm joined by Danielle Lewis-Wright, who is the Associate Director of the Division of Eligibility and Policy within Healthcare Policy and Research Administration. I'll also be joined by Ryan Kuntz, who's a member of our DCAS team. Up first will be the Alliance and ICP Restart overview, in which I will toss to Danielle. So Danielle, when you're ready, we will begin with the Alliance and ICP overview.
All right. So good morning, everyone. We're going to get into the slide deck that we prepared. So today's presentation will cover Alliance and ICP Restart, and also will highlight the changes related to Alliance and ICP to MAGI methodology and the income standards that align with MAGI. Also, we'll discuss additional changes to the Alliance program, specifically no face-to-face interview or resource test. We'll also discuss the Alliance and ICP eligibility requirements as well as verification requirements. We'll spend some time to talk about the Alliance and ICP renewal process, and also ways to complete and submit the Alliance and ICP renewals. And then after we talk through the systems part, then we'll open the floor for questions and comments. I wanted to highlight at the beginning of this presentation that you will hear the terminology renewals and recertifications used interchangeably. They mean the exact same thing. So I wanted to highlight that. Next slide. So the district's public health emergency ended on July 25th, 2021. The federal public health emergency is still in effect, and it governs the Medicaid program. The Alliance and ICP household eligibilities have been extended through July 1st of 2022, and now we have resumed renewals for our Alliance and ICP beneficiaries ending on August 31st, 2022. I want to highlight that in total, there were 375 ICP renewals that were mailed out with the certification end date of August 31st, and 2,776 Alliance renewals that were mailed out at the with an effective certification date, end date of August 31st, 2022. At renewal, Alliance beneficiaries are required to verify income and residency, and we have a slide dedicated towards acceptable forms of both. Next slide. So over the last 2 years, there have been changes made to the Alliance program and ICP program, and wanted to walk through a few of those for you all on this call. The Alliance and ICP program now use MAGI methodology. That is the same eligibility requirements used for household and income for Medicaid categories, childless adults, children, parent, caretaker, relatives, and pregnant individuals. Under MAGI rules, we use household composition and tax filing rules to determine income. And for individuals who do not file taxes, then those individuals are considered non-tax filers, and the rules would apply for non-tax filers as it pertains to determining household composition and income. One of the reasons, and really a few of the reasons as to why we moved towards MAGI methodology, is that it promotes parity between MAGI and our locally funded programs. And also the Alliance program no longer has a resource test of $4,000 for one individual and $6,000 for a household of two or more. So there's no longer a resource test where some beneficiary or applicant would have to provide a savings account or checking account or proof of either to be eligible for our Alliance ICP programs. Next slide. So I'm not going to go over this slide in detail, but I wanted to just illustrate the change in terms of our FPL for MAGI, under MAGI methodology for the Alliance program. This is based on 215% of the poverty level, and this is what it means in dollars and cents. And then the chart on the right illustrates what the FPL is for children, which is 324% of poverty, and what that means for a household. Next slide. So in terms of changes made to our Alliance program, the certification period has increased to 12 months and there's no longer a face-to-face interview. So want to just make sure that we're clear about what that means for the renewals that have already been issued for August and September. The effective date of the change is October 1st of 2022 for the 12-month renewals. So for renewals that have been sent out for August and September, the certification period will be for 6 months. And April and May, when they renew coverage, that's when the 12-month time period would apply. There is no face-to-face requirement for Alliance or benefit individuals at initial application or at renewal. And just a reminder, the certification period for ICP has always been 12 months and it continues to be 12 months. And also wanted to highlight for Alliance and ICP beneficiaries, they can now use District Direct to complete an application, their recertification, report changes, and we strongly encourage individuals to use District Direct online options and mobile app to do all of those various functions. Next slide. So this is just a highlight of the eligibility and ICP requirements for Alliance. An individual has to be 21 and over. You have to be a district resident. We talked about the income threshold of 215%, and you cannot be eligible for Medicaid or other third-party health coverage. For our immigrant children's programs, it's individuals at 20 years old and younger. You have to be a district resident. We accept district attestation of residency. We talked about the income threshold of up to 324% for individuals newborns to 18, and for 19 and 20, 221%, which aligns with a Medicaid policy as well. And you cannot be eligible for Medicaid or third-party health insurance in either programs. Next slide. So this is a list of acceptable forms of income verification, just highlighting a few. An individual can provide their recent pay stub from the last 30 days, if self-employed, a tax return, an unemployment statement. And then for residency verification, they can use their identification card, DC-1 card, a driver's license, an active lease, or utility bill. And also we still allow folks to submit and complete the residency form. Next slide. So wanted to share with you all the changes as it relates to the Alliance and ICP renewal process, and also for folks to become more familiar with the forms that are issued and when they're issued. So renewal forms under MAGI methodology, which now governs Alliance and ICP, will be mailed out 60 days prior to the end of the certification period. Hence the reason why renewals were issued on July 1st for this first group of individuals recertifying for coverage. Previously, it was a 90-day period. And then also for the vast majority of our Alliance and ICP beneficiaries who are renewing coverage. They are considered converted cases, and these are cases that have been transferred from our old system known as AC to District Direct. And in order to be fully converted and for us to redetermine eligibility for continued coverage, household must complete the converted renewal form. Now, you have the option to complete the form online. We are strongly encouraging individuals and families to use the online options, the mobile app options as well. But just wanted to show you all what it appears if someone comes to you and asks for help on the form or how they need to navigate this information that you're familiar with. Then, next slide. So now it's time to renew eligibility, and it is really important to encourage the people that you work with and the community and our beneficiaries to renew timely. And the options that are available and that we are strongly encouraging beneficiaries to use is the online option. So District Direct allows individuals to complete their renewals and submit their renewals online through an open with their mobile app or the website. And so we're going to go into that in a little bit more detail, but again, it's highlighted in red for a reason. We really want folks to renew online. Also, you have the option to complete a renewal telephonically, and this is the number to call, the 202-727-5355. And if you need help with language and translation, there's a number, the 1855 number that appears here on this slide. There's also still the option to mail in your completed and signed renewal form. To drop off that form, the completed form is still an option, or to fax. Now, of course, if you submit the renewal form online, you do not have to then complete the paper version of the form and submit it again to ESA. We don't want to do that at all. Once it's online, we have it registered. Okay, and next slide. Okay, so now we're going to turn to the District Direct portion of the presentation.
Thank you, Danielle, for that overview of the Alliance and recertification process. Up next, I should be joined by Ryan from our DCAS team, who will walk through how individuals can create their account on District Direct or using the mobile app. Ryan, are you with us?
I'm here.
Okay, Ryan's going to be speaking over some videos. We're going to play those videos now.
Thanks, Eugene. All right, so the first video that we're going to play here is the first step. You know, if a user if a client decided to download the mobile application through the Google Play or the Apple App Store. Here's the landing page when they would log in. At the bottom, you can see there's a create account link. By clicking that create account link, the client's shown their confidentiality, terms and conditions. But to create an account, the minimum requirements is just a first name, a last name, a unique username, and a password. Now, the user is also given the option to provide an email address, which we strongly recommend doing because it helps with account recovery or password reset. What you're seeing here is that the person entering is entering their email address here, and they're prompted with the option to use their email address as their username. You can see if they select yes, you know, that username is pre-populated for them. If they go back to the previous screen, they say no, you know, the client can decide that they want to provide a distinct username. So they're going to enter, you know, a distinct username that's not associated with their email address. So they have their own username and a password. Password requirements are listed on the screen. It might not look like anyone's typing in there, but I assure you they are. The video is just hiding that because it's sensitive information. So once they hit create account, you know, and they should get an account created, a success message, and they're now able to log into the District Direct website or the mobile app. So they're going to enter their username and their password. I'm just waiting for them. Yep. I think the first time they log in, you didn't enter your username correctly, so Just fix that real quick and hit login. Now they're logging into the mobile app. So before we move on to the next one, I just want to talk real quick about what they see right here. What they see is I've just created my account and I've logged in for the first time. What we're going to do next is say I'm a client who's receiving an active benefit. I need to associate my account with my benefit. So what we're going to do is we're going to connect our identity, connect our account. So that's what we're going to do in the next video. So here we're going to connect our account. You can see they're immediately asked to do that. They're going to link their case. To connect your account, it's similar to the create account portion where you need to enter your first name, your last name, but we need a little more information. We need your date of birth, sex, and then we need you to provide one of 3 identifying pieces of information, either a social security number, a person reference number, or your medical ID number. And what's going to happen is that needs to match what's in the DCAS system so that we can associate you with your benefit. You can see here, they entered their information, they got the success, and now we see a new screen. And at the very top, this client is obviously receiving a benefit. You can see the cases. They don't have any outstanding verifications, but at the very top, it says, hey, you have a recertification renewal due. So if you click that link, it'll take you over to District Direct, and it'll take you into that renewal form, which can be submitted online and processed right here. So that's the flow through the mobile app. What we're going to do now is we're going to show you through the website. Now, just to make sure everyone's aware, it doesn't matter if you create your account on the website or on the mobile app. That same user credential can be used in both places. It's a centralized username that can be used across both systems. But here we're just going to take you through the create account flow on the website. This is the home page. At the very top, there's the create account link, which we're going to select. And then the requirements are the same as in the mobile app: first name, last name with an optional email address. You have the option to use your email address as your username, or you can select a username that you would like. So we're just going to walk through this form real quick, creating a different account for Laura Smith. And you can see if you select this checkbox for use email address, it pre-populates the username for you so that you have your email address as your username, or you can unselect it, enter your own username. Enter a password, same password requirements. And then once they've completed that, they hit create account. And they should be provided a message that says, hey, your account has been successfully created. Please click login to continue, where you can enter your newly created credentials to log into District Direct's website. One thing about the website is the first time you log into the website, it's going to ask you to set up some security questions. These security questions are just used in the case you need to recover your account. You can use these to reset your password. So that's why you're asked the first time you log into the website, but you're not going to be asked again. All right, so Laura's now successfully logged in. She's also presented that unconnected version of the application. You only have access to some information because we need to associate you with your identity in the DCAS system. So that's what we're going to do in the next video. I see there are questions. We'll definitely get to those. All right, so Laura is now logged in. You can see she's also prompted to connect her account. Even though she's not connected, she can do a couple of things in the application, like still apply for benefits. Here's the benefit selection, which would take them into the application. But once they select something that requires you to have a connected account, it'll immediately prompt you like this. And it's the same requirements as the mobile app to connecting your account. It's going to go back. There's also a connect account button on the main landing page, which is what we're going to select now. First name, last name, date of birth, sex, and one of those identifying pieces of information. Here they're going to enter the person reference number, provide that information, and hit submit. If that information is found in DCAS, they'll be presented with this success message. And when they hit continue, they'll now have the full dashboard available to them. And at the very top, you can see Laura has a DCA case that's due for renewal with a button where they can click to renew their benefits. There are a couple of different places where that alert will show, just to kind of continue to remind Laura that this case is due for renewal and that she needs to, go in. One is on this cases screen. You can see the alert is there. If you hit that renew button, it'll take you to the renewal. You can also just go to my information at the very top. And there's also a card there that says recertifications and renewals, which can be selected. And if you select that, anything that's due for renewal will be listed on that page where you can submit your renewal. I think we're going to go back to the home page though and just click the renew button from the dashboard. All of these different places though will guide you to that renewal script, to the same place. So clicking renew, it takes you right into your renewal, where you can start the renewal form and submit it online, just like you can on the mobile app. And what they would do is they'd fill out this form and go through the full script and hit submit, which would submit their renewal on their behalf. All right. So do we want to go through some of these questions, or are we going to go through them at the end?
Well, we are at the end. So I think, so Ryan, just hold on. So what we want to say is, again, the district director is there. We are hoping it can be the more efficient process for individuals who have to renew. It's available online, English, Spanish, and Amharic. Also, I think DCAS folks, if someone could speak to the language translation availability on your phone when you're using the mobile app, it'll also be available in multiple languages. So when you go to that District Direct landing page, you'll see the 3 language options at top, and you can select the language option that you would need to complete their application in. Tamika or Ryan, can you speak about how folks should translate the app on their phone?
I can talk to that if you'd like.
Go ahead, Ryan.
Yep. So the way the phone works is that it's going to reflect whatever language the phone has selected. So if a user at the phone level, at the phone settings and the general settings of the operating system, if they have it selected as English, it's going to show you the English version of the app. Users who are, have their phones set in Spanish language, that's how they're going to see the Spanish version of the app as well. Those settings they live within the universal settings of the phone. So, in your general settings where when you set up your phone initially, where it asks you what language you would like to, see, if you selected Spanish, then you would see the Spanish version of the app. Same with English or Amharic.
All right, so here we're going to have a website, and it's going to link from the General Alliance website that's on the DACF landing page. We're going to have all the information available. There'll be answers to frequently asked questions, the recording from this meeting, translated versions of the frequently asked questions for Alliance will also be available. We have a dedicated Alliance and ICP renewal restart questions email address that you can send email questions or prompts to. And again, if you have any questions about Alliance requirements or anything you've seen in the presentation today, you can direct those questions to Yemi in DEP, or again, as you heard from Danielle, you can also direct those questions to her. So I know we have a lot of questions in the chat. What I'm going to do is bring up the chat and we can start walking through those questions. So I know a few of them have been addressed and responses have been provided in the chat, but what I'm going to do is just start at the beginning. And if we provided an answer in the chat, I'm going to reiterate that answer. And if there's a new question, or if individuals at the end of this want to unmute themselves and ask a question, we'll do that as well. So again, all of the information that we present today, this presentation itself, the slides, all of this will be provided online. Also, if you got the email link to this meeting, we'll provide an email attachment of all these materials as well, so that everyone is operating from the same information. Also, again, online, there'll be FAQ, frequently asked questions, for any individuals who want a quick answer to something that may come up in their discussions with beneficiaries who are renewing. You can see answers to those questions online, or again, you can email the emails on your screen with those specific questions. So jump in the question from Aaron Sperry. Question: District Direct sometimes does not provide the option to upload required verification documentation online after applications have been submitted. What is the best way for consumers who don't have the verification document option to upload required materials? Tamika, I know Tamika, who is our, I believe, acting director of DCAS, answered that question in the chat. But Tamika, do you want to answer the question for all those folks on the call?
Yes, good morning. Sorry, this one is the upload verification, right?
Correct.
Okay, so as of June 30th, we went ahead and provided an update in the system that whenever you are submitting an application, you'll be able to submit your verifications right away. You no longer have to wait until it's looked at and it's prompted for that particular verification.
Thanks, Tamika. And it looks like we have the next question. I think it's also District Direct related, from Veronica Hernandez at Mary Center. Question: What will be the next step if a DC Alliance beneficiary is not able to connect the account? I know several clients that have not been able to connect their accounts. Tamika?
Yes, so if a DC Alliance user is not able to connect their accounts, I would ask that you contact our call center. That number is at 202, and it's in this presentation as well, 727-5355. One of our call center reps will provide further support. Either they will help the person through the process at that time, or if it's an issue, they will take the information, the customer's information, and then we will provide it to our technical team. They'll do what needs to be done on the back end, and then our call center rep will reach out to the customer to provide them the information so that they could continue connecting their accounts. I'm sorry about that. Continue the connected account process, and then they can establish their online account. Sorry.
Thanks, Tamika. We have a question from Tracy Thompson. What is the turnaround process after a beneficiary submits their renewal online? Tamika, not Tamika. Danielle or Tamika, do you want to speak to that?
Danielle?
I can speak to it. So in terms of submitting your application online, this is why we're encouraging beneficiaries to do so, because it registers your app and do renewal. And so while it's registered, coverage will continue. The policy remains in terms of processing the renewal on, I would say that we have that 30-day period to allow time for ESA to review the information submitted. So it's fair to say in that time period. But again, if you submit it online, then it preserves that renewal until the full determination is made. And we look at your eligibility factors to verify if you remain eligible for continued coverage.
Thanks, Danielle. Next question from Daniela Rincon in the chat is the app or website available in other languages such as Spanish or Amharic? And the answer is yes. As shown on the, as shown on the previous slide, and as we just walked through, the app is available on the website in these three languages. And then on your phone, if you select the language that you want your phone to operate in, the translation should also be reflected in the mobile app. Question from Sandra in the chat. Where do we submit conversion renewal forms? Danielle?
So on the slide there, we could just go back to that slide right there. This is really helpful. So the next slide for Eugene, where it says ways to submit, right here. So our slide here gives you all of the various options to submit the renewal form. Again, I'm going to continue to encourage online, but if there is a paper version that you have beneficiaries completed and signed, then this is the mailing address. And this address is also on the hard copy of the renewal form.
And to reiterate what Danielle shared, if you complete online, you do not need to mail that renewal form in. So for folks going through District Direct and completing their renewal online, you don't have to then submit the mailed form through mail or drop it off at a service center.
And to just follow that up, when you go online or on mobile, you will see a link that will state your renewal. So it'll basically pop up. You'll see the link, and all they have to do is click on the link, and it'll take you to the renewal. When you are on the mobile application, the link will take you to the online, it'll send you directly to our online portal, but your phone settings will kind of allow it and transform the phone into the settings of the online portal. So it's seamless. We just don't have the full script inside of the mobile application right now, but it will take you online seamlessly, and the customer will not know the difference between the two. So
Thanks, Tamika. Question from Sandra. How do we retrieve username in District Direct if consumer does not provide an email address? Tamika?
So the user, and Ryan, I will ask that you keep me honest on this one. In order to set it up, you have to have an email address, because and whenever they would have signed up with the username, it would have been via their email address as well. So I believe that the individual would have already provided us the email address. Ryan, is that accurate?
So what I would say here is that we would definitely recommend anyone who's creating an account to provide an email address when setting up their account, because that is what's definitely helpful in recovering that account. But yeah, email address obviously is not a required field, but we would again, I'm sorry to say it again, but I would definitely recommend people provide one.
So
if you're in a particular situation where you do not have that email address, please contact our call center, and we will be able to address the person individually and figure out the best way to connect their accounts.
Thank you, Tamika. Thank you, Ryan. Next question. Is there a direct tech support contact for consumers? Is there a District Direct tech support contact for consumers? And I believe Tamika went over this. It's that call center number. We'll make sure that call center number, it appears in this presentation already. If there's issues, individuals should be calling this number, correct, Tamika?
That's correct.
And that number for those who are just listening by phone, it is 202-727-5355. Next question. Is there a list of providers or sisters that we can refer enrollees to for assistance? Is a list in the DC Link website accurate? What we'll do, we've been in communication with HCBX on this, and there's some additional coordination with them upcoming this week. We'll make sure that for individuals who need assistance, we'll try to put that information on our website at the Alliance FAQ link so that individuals can get that information. Danielle or Tamika, do you know if the information that's already on the DC Link website, I imagine if it's there, it's reliable, it's useful information, but if we can, we may just need to circle back with HBX to confirm, but we'll also make sure that information is on our website. Danielle or Tamika, do you want to add anything to that?
No, that's correct.
Next question from Sandra. Where do we submit the paper application for conversion renewal form? There's a few options here. If you look on the presentation on the screen, by mail, drop off, or fax. But again, we are encouraging individuals to complete their renewal online using the District Direct website option or through the mobile apps on their phone. Question from Kiana Smith. Is there a text message in Spanish or Amharic we are allowed to send out to the enrollees? Danielle, do you want to speak to this?
Not at this time. We can, take that back, and I'll need to have a few internal discussions.
All right. From Dana Ortega. If the applicant does not have a phone or computer access, can they go to ESA office or get the forms in case they didn't receive them in the mail? Danielle?
They should be able to go to ESA to pick up a form, and then so that should be an option that's available.
Thanks, Danielle. Another question from Ada Fitzgerald at Legal Aid. Are the call center reps all trained in providing District Direct tech support, or will they connect consumers with someone? Tamika?
Our call center will tier 1 triage the individual scenarios with the applicant. If they are unable to, they will collect the customer's information and they will pass it along to our technical team, who will then work on it. And then once the issue has been resolved, they will provide it back to the call center rep, who will reach out to the customer. Our service, what we try to do is provide responses back within 48 hours.
And we have a question from Tracy Thompson. Her question asks, can you reiterate again the change from 90 to, I believe she means 60 days? Danielle?
Sure. So the 60-day advance notice of mailing out the renewals aligns with how we mail out renewals for individuals who fall under the MAGI methodology. As shared during the presentation, for Alliance and ICP beneficiaries, we now use that methodology to determine household composition and income. And so we are aligning the standards for MAGI Medicaid with Alliance and ICP. And therefore, we're mailing out and using that same cadence of sending out the information 60 days in advance.
Thanks, Danielle. So it looks like we've exhausted the questions in the chat. I'm going to embark on always a risky proposition. The folks who have questions who are on the phone line or or otherwise in the meeting, do they want to unmute themselves and ask a question? Let's see if we can get anyone participating by phone. Feel free to unmute yourself to ask your question. We'll try to go one at a time. Let's see if is there anyone on the phone or otherwise in the meeting who wants to unmute themselves and ask us a question? Again, we are scheduled to go to 11:30. But if we get through all the information ahead of that, the meeting can conclude early. Just wanted to provide at least one opportunity among many that will be coming up to walk through the Alliance and ICP renewal restart, give individuals an expectation of what they should expect, and also encourage and walk folks through the use of District Direct to submit their renewals. Is there anyone who either wants to type in another question in the chat, or does anyone want to unmute themselves and ask us a direct question?
Hello, good morning, everyone. This is Sandra Huerta from Community of Hope, and I have a question on regards to the DC Alliance application on the District Direct. When you complete an application through District Direct, most likely when it's for the age, or if the person selects disable in the application, it prompts a second portion of the application, and that second section that might be for the age, blind, and disabled, for cash assistance or food stamps. The DC Alliance applicant might not qualify for those benefits. What should we do in those cases with the DC Alliance application?
Danielle, Tamika, do you want to speak to that?
So I'll speak to it from the system, and then Danielle, if you want to take it from the policy standpoint. Whereas, yes, if right now the Alliance and Immigrants Children Program applicants should be able to complete everything with our first part of our script, which is on our one side. Let me use non. So they should be able to complete it without moving over to the other part of the script. But if they do have one of the conditions of age, blind, or disabled, then it will prompt them to either stay on what we call Magi Medicaid, or it'll move them over. So Danielle, if you want to speak to if they are age blind and disabled, what the applicant will be prompted with the second part of the script and what they should do.
Sure. So it does, in terms of the application flow, when that question is asked about disability, it will have a whole new set of questions. And those questions are designed to determine if a person would qualify in a different category. And that's the rationale behind those questions. I think probably the concern here is if we know that the person, based on how they attested to U.S. citizenship or eligible immigration status, and we know that and based on that response, they would only be eligible for our locally funded programs, but probably why are we then asked those additional questions? But it's just, I just wanted to explain the reason behind why that happens. Now, if they're only eligible for Alliance due to the fact that they only qualify for locally funded programs, then they would not transition into Medicaid under any category because they wouldn't qualify. So I hope that that additional information provides some insight there.
Thanks, Tamika. Thanks, Danielle. Are there any other questions by phone, or does anyone want to, again, if you have questions that you want to type in the chat so that I can read them out, feel free. Does anyone else want to ask a question directly to the HCF staff?
This is Aida Fitzgerald from Legal Aid Society of DC. I'm wondering, is there who consumers might contact if the call center is not helpful? So if the call center doesn't resolve a tech issue, doesn't call back within 48, 72 hours, is there someone else they should contact about District Direct issues with their Alliance or ICP renewals?
Tamika, do you want to talk to that one?
Right now, at the moment, our only source is through through our call center. If we feel that they're not being helpful, then I will take that back and I'll discuss with Eugene and Danielle on what other, another avenue. I would assume that this email address, DHCF Alliance Research, may be, oh no, I'm sorry. That's, is that an email address that you
Yes, it
can come
is.
with
It is.
questions?
Yes.
It can be used.
That you can use that for now until we put another avenue, but we do want to drive everyone to our call center so that they can get the support that they need.
Question from Tracy Thompson. New here to the process, all the abbreviations you mentioned. ICP, that's the Immigrant Children's Program, locally funded healthcare program that provides healthcare access to individuals who might not be eligible for Medicaid in the district because of the citizenship requirement. But the district does provide coverage for those up to, and Danielle walked through it. It is up to 324% of the federal poverty line who are 20 and under. MAGI. MAGI is modified adjusted gross income. It refers to the methodology which DHCF uses to determine eligibility for its healthcare programs. DHCF is just a Department of Healthcare Finance. We are the single state agency in the district. We administer the Immigrant Children's Program, the Alliance Healthcare Program, the Medicaid program in DC. That's what all those abbreviations stand for.
And Eugene, I just want to add that the question about a DHCF website have abbreviations available. Wanted to share that our website has a breakdown of the various programs, both locally as well as MAGI Medicaid and our ABD, home and community-based waiver eligibility categories on our website if you want to read and review more information about what that means in detail.
Thanks, Danielle. Follow-up question from Sandra. Should we proceed with the second section of the DC Alliance application if we know that the consumer only qualifies for the locally funded DC Alliance program? Tamika, do you want to answer that one?
I think I think that I should pass that off to Danielle because from a system standpoint, they can stay, they don't have to, but I want Danielle to kind of respond to that from a policy perspective. And I think she hit on it in her last response.
Got it. So Sandra, from a system standpoint, it sounds like they don't have to, but Danielle, I'll let you reiterate what you spoke about earlier.
Sure. And then from a policy standpoint, it's no requirement to proceed to the other questions that it appears because we have the option of folks looking at other categories in addition to what they initially applied for, but it is not required. And if you are experiencing, like if your experience is that it appears to require us to answer all of those questions, please let us know. Please email the DHCF Alliance Research at dc.gov email so that we can take a look at that and provide more information if needed.
Right. Any additional questions from those on the phone, or does anyone want to type an additional question in the chat? And again, we are scheduled to go till 11:30, but if we conclude before that, if we exhaust all questions before that, we won't keep everyone. And again, all this information, recording of today's meeting will be up online after the meeting, and we'll also mail out materials that we went over today. Any additional questions from anyone on the phone, or does anyone want to type an additional question in the chat? All right, we'll let it hang out there for about a minute. And if no additional questions come through, we will conclude.
I'm sorry, can I just also add though that for renewal process, You will not be prompted with the other parts of the script. That only happens in the application part. So Sandra, if you are working with beneficiaries who are going through this process for renewal, they won't be prompted the other kind of non-magi questions for age, blind, or disabled. So that should alleviate some of that for you.
Thanks, Tamika. All right, it looks like we've exhausted all questions. Again, we want to thank everyone for joining us today, answering the call to help us outreach to individuals who will be renewing, recertifying their ICP and Alliance benefits. Again, we want to read. Oh, Aisha Gray, one last question. And then we have a question from Yasmina. Aisha, do you want to type your question in? Oh, she's trying to type quickly. So Danielle, can we talk about our unwinding expectation? As individuals know, or may know, the federal public health emergency was renewed on, I believe, July 15th. And the renewals traditionally have happened for a full 90 days. Now, the Biden administration has said that they would tell states 60 days in advance if they intend to end the federal PHE. We have not received that 60-day notice yet, and we currently don't have any expectation of when we might receive that. So our Medicaid renewal process will begin from that date. And Danielle, can you just give a brief overview of what individuals should expect and how the DC specifically will conduct its Medicaid renewal process?
Sure. So the first thing that I want to highlight about the unwinding of the PHE is the importance of making sure that beneficiaries update their contact information. As shared during this presentation, and I'll reemphasize here, it is important that they go online and update their address information, adding contact email address as well as phone number. That is really critical because once we resume normal eligibility operations, we have to renew coverage for our entire Medicaid population. And in order for them to know that it's time to renew, we will be sending out communications in so many different forms, but they are going to have to provide us with updated contact information so that if it's something specific to them and their families, they're receiving it. So I can't stress how important making sure that you're sharing updated information to the agency is in terms of renewing coverage. We will provide, once we have a date for the end of the PHE, our plan is to send communication so that folks understand what that means to person who receives coverage and the importance of renewing timely. We are also in the process of working with, and we have a solicitation out for outreach and communications vendor to help us get the word out about the unwinding of the PHE and what it means to our beneficiaries. And so more to come on that end. We also are starting a roadshow where we're talking about the Alliance, and we know that this question will come up as well. So our goal and intent is to really touch as many areas as possible about A, the importance of updating your contact information, and B, how we plan to roll out renewals moving forward. We also are really thinking about best strategies, ensuring that we are focusing on beneficiaries who are set to renew on a rolling basis, their monthly rolling basis. And so there's more to come in that area as well.
Yasmina sent a follow-up question. Will we set up a similar meeting like this for that change? Yes, we'll work through the MCAC. We'll work through the eligibility enrollment subcommittee of the MCAC. We'll work through similar meetings like this to make sure that all individuals are aware of any upcoming change to the Medicaid renewal process, which are, of course, paused for now because the federal public health emergency is still in place. So, question from Aisha. Aisha, I worry we may have to get back to you on this one. During recertification, if a beneficiary doesn't select an MCO at the time of submission, how will that individual be assigned? Will they remain in their current health plan, or will they potentially maybe change their health plan via auto assignment? Danielle, what you mean? I don't know if we have an answer to this one. We could circle back with our MCO folks and get confirmation and follow
Well,
up.
I can speak to what happens at recertification
Sure.
as it pertains to your MCO. So you remain in your MCO when you renew coverage. The goal is to renew timely. And even after, if you don't renew timely for that month period for our Alliance beneficiaries, you have a grace to submit your renewal forms and you're automatically assigned back to your previous plan. It doesn't allow for open enrollment. That has been the traditional standard of recertifications. I can't speak to if there is something different as it pertains to our managed care plans, but to the question of recertifications, I wanted to share what we have historically done in terms of automatically maintaining the beneficiary's MCO.
Thanks, Danielle. All right. Prompting closure last time got us more questions. Okay, we have another question. I've seen from Sandra in the chat, I've seen that some DC Alliance consumers have been automatically renewed. Would you please explain the reason, and if everyone who has DC Alliance is being renewed? Danielle, can you talk about the rolling renewal process that will happen from from August forward?
Sure. So just want to highlight that for our Alliance beneficiaries and our ICP beneficiaries, there isn't any option of what we consider passive renewals. It's not available because we need to have a Social Security number. And yes, there are times where our Alliance and ICP beneficiaries have a Social Security number, but as shared with you all on during today's presentation, the fact that the vast majority of these cases are being converted from our ACED system to our DCAS system. And so that means that we have to ask for very specific information, in addition to the fact that we also are aligning our MAGI methodology rules. So the option of a passive renewal just does not exist. And so if there is an example of what you have seen, please send it to that email address, because I want to just make sure that across the board, people are clear about expectations for renewing both populations.
And Sandra, it's not everyone who received a notice started receiving a notice as of July 2022. It's just about 2,776 Alliance renewals that went out and 375 ICP renewals that went out. That number changes each month. So your termination date or your renewal date is tied to when in our system you will need to renew. So not everyone will need to renew by August 31st, 2022, but it's starting July 1, and then each month forward, individuals, again, depending on when their certification date or renewal date is in our system, they should expect to start receiving these notices. Did we answer your question, Sandra? I think we came at it from a few different angles. All right. Looks like we answered Sandra's question. Putting another call out there. Any additional questions? If you want to unmute yourself and ask this question directly, feel free. Or if you want to type your question in the chat, we will read it and respond. And again, just want to reiterate that all of the information that we shared today, a recording of this meeting, and materials will be up on the DHCF website as well as an English version of the frequently asked questions responses that I know we're working on translating to get up in some other languages as well. Any final questions to close us out? Okay, I tried this before and we got some additional great questions. So I'm going to try one more time. Thanks for attending today. Thanks for all those who attended to answering the call to help DHCF in the district perform outreach to those who may be receiving renewal notices. Again, we want to strongly encourage everyone to go online to submit their renewals. Hopefully that's the quickest and simplest process that our beneficiaries might find. But again, all the ways that individuals can drop off their renewal or complete their renewal are on the screen. All of the information that presented today will be up on the DHCF website. And to those who received an email version of this meeting, we will also try to email out these the materials that were shared today. So with that, so it looks like we're getting some comments in the chat. This has been a very useful meeting that individuals would like us to continue that. We are going on a little bit of a road show. We may post where individuals can see more information like this in the upcoming days and weeks on that same FAQ page, just in case individuals may want to attend a meeting like this. And we'll keep this feedback in mind that this was very helpful. So again, thanks everyone for attending today. This information will be online and emailed after this meeting. Thanks everyone for attending. Thanks to Danielle, Tamika, and Ryan for helping me present today. Thanks everyone.